Sodexo, February 2023. Training on bloodborne pathogens. Bloodborne pathogens are in Sodexo, February 2023. Training on bloodborne pathogens. Bloodborne pathogens are infectious microorganisms found in human blood, bodily fluids, or tissues that can cause diseases in humans. Examples include hepatitis B virus, HBV, hepatitis C virus, HCV, human immunodeficiency virus, HIV, transmission of bloodborne diseases. In the workplace, bloodborne pathogens primarily spread through injuries from needles and other sharp objects. They can also be transmitted via eyes-mouth, mucous membranes, broken skin. Parenteral contact, which involves piercing the skin. Understanding bloodborne. Diseases, occupational risks. Occupational risks involve work-related exposure to bloodborne pathogens through direct blood-to-blood contact, typically via sharp instruments like needles, other potentially infectious materials, OPIM. This category includes human body fluids such as saliva, especially when mixed with blood, any body fluid when it's challenging to distinguish between fluids, unfixed human tissue or organs, cultures containing HIV or HBV hand, hygiene guidelines. Always wash hands before and after glove removal. Wash hands following exposure to blood or potentially infectious materials. If soap and water are not immediately available, use alcohol-based hand sanitizers and wash hands at the earliest opportunity. Safe work practices. Be cautious of hazards like broken glass, used needles, towels soaked with contaminated fluids. Personal protective equipment, PPE. PPE is crucial for protection against unforeseen hazards and should always be clean and well-maintained. Essential PPE includes gloves, masks, eye protection, face shields, and protective clothing. It's vital for anyone at risk of exposure to blood or OPIM. PPE should effectively block infectious materials from reaching personal clothing, eyes, skin, or mouth. When tasks are likely to generate splashes of blood or bodily fluids, appropriate PPE such as gloves, eye protection, face shields, masks, and protective clothing should be worn. Options like hypoallergenic or powder-free gloves should be provided. Hepatitis B vaccination offered at no cost to employees at risk of occupational exposure, employees after potential exposure to blood or OPIM response to exposure, incidents. Inform your manager or supervisor and seek immediate confidential medical evaluation, which includes documentation of the exposure incident, counseling, evaluation of any symptoms, testing of the exposed employee's blood, biohazard warning signs and labels. The biohazard symbol should be fluorescent orange or orange-red with contrasting color lettering. Red bags or containers can replace labels for biohazard warning. Contaminated PPE must be disposed of in designated biohazardous waste containers.